Hi, my name is Philip. I'm a doctor of physical therapy, and I'm here to tell you how to decrease your back pain with the Feel Good Method. The goals of the Feel Good Method is to learn, to practice, and feel pain-free. With my online modules, I'm going to teach you a routine that shows you how to exercise properly. So we're going to get rid of that back pain and maintain the gains you make with the Feel Good Method for the rest of your life. All I ask you to do are exercises up to 15 minutes, and only 4 out of the 7 days of the week is needed to make your back feel better. So, what are the secrets to stop back pain? Let's learn how. Stop back pain with an easy at-home exercise program. The Feel Good Method does this with 3 easy steps. Step 1 is mobility, teaching you how to stretch. Step 2 is strengthening, teaching you how to engage your core and your hips correctly. Step 3 is functional mobility, teaching you proper mechanics during daily activities. Whenever we're trying to decrease back pain, the secret is to improve your motion first. With tight muscles, you can have restrictions that shouldn't be there, poor postural control with the bending and lifting or standing, and this is all caused from tight muscles that are not letting go, pulling at the joint when it shouldn't be, and also causing you to have imbalances, whether you have one hip is hiking, the other leg is shorter, or you're having a lot of pain from standing because the posture is pushing your back to close and tighten. So the solution is stretching, making sure that the muscles are at optimal length when you move, and also massaging these tight muscles so that they can let go of that restriction that's causing you to have pain. The second step of improving your back is strengthening. The issue is when we have weak muscles, it can lead to muscle strains and sprained joints. When your muscles do not have the optimum strength, it's going to put too much stress on the joint of your back and cause misalignment of your pelvis, which then can hurt you even more. The solution to this is strengthening your core, strengthening your glutes, so you don't have instability when you're bending and lifting, standing, or doing any strenuous activities. The next step to decrease back pain is function. When you improve your mobility and your stability, this leads to decreased pain and better quality of life. So we need to teach you proper mechanics when it comes to getting up and down from a chair, sleeping positioning, bending and lifting. So the solution to live a better life every day is by subscribing to the Feel Good Method and learning how to improve your motion, your strength, so that your day-to-day routine becomes pain-free. So who does this online program work for? So let's find out. The Feel Good Method is for anyone with pain at work or doing housework, individuals who have different back pathologies such as disc herniations, issues with degenerative disc disorders, or stenosis, pain with recreation activities, issues with sports, or pain during pregnancy. So, who should not participate in the Feel Good Method? The Feel Good Method should not be performed if one has not received medical clearance to start exercising, if someone has radiating numbness or tingling or pain that goes down the legs that have not been discussed with the doctor or medical professional, or if someone is at high fall risk when performing exercises. So safety is a priority. So if you're at a chance of falling, doing the Feel Good Method alone at home is not recommended. The Feel Good Method can be found online at hotmart.com. Here's a sample video of how to do my exercises at the comfort of your home.
Let's learn how to do a seated piriformis stretch. Bring foot towards knee and gently bring yourself forward. As you're holding the stretch, you're going to feel a stretch into the glutes and release the stretch by leaning back and bring the foot back down. Take the opposite foot, bring it towards the knee, and lean forward gently until you feel the stretch. Your goal is to feel a stretch into your glutes and hold it. Do not lean too far where it's uncomfortable. This is a great stretch to do if you have pain when you sit for too long. Maybe you have a desk job and you're starting to have hip pain. So this is an easy stretch to do while at work. Or if you find yourself standing a lot, most likely you're going to be overworking one side versus the other. So that side where you're having back pain with standing, it's a great stretch to do to decrease that pain. So the piriformis stretch is very easy to do. All you do is you bring your foot onto the knee and then lean forward.
It's good to have a testimonial from a client who's actually gotten better with the Feel Good method. So here's a video of Judy explaining how her experience was.
Hi, my name is Judy. I can't say enough great things about the Feel Good method. I purchased it because I didn't have time to go to PT and I had a lot of lower back pain. The videos really helped me decrease my back pain, improve my motion, and get back to things I like doing in the convenience of my own home. I really recommend it. You won't go wrong.
The Feel Good method did not start overnight. It's been a process that I've been building up for a while since the pandemic. Here's my story of how I got into doing online videos to help people feel better and decrease their back pain.
During the pandemic, I realized I could help others. How? Well, I was able to get my patients to feel better without them having to come to the clinic. I was doing online instructional videos demoing how to do the exercises safely at home. With success, I was able to get the patients to decrease their pain and return their function. They were able to walk again, reach again, and do all their day-to-day routine without having that same pain that used to come to the clinic and talk to me about. So, for me, I'm here to help you at home. I'm trying to have you avoid dealing with all the health insurance issues of getting either to go to the doctors, pay co-pays, deal with deductibles, and then get you just to do my online videos and feel better at home.
If you're thinking about purchasing the Feel Good method, it's important to know how is it set up? How am I going to access the modules to feel better and decrease my back pain? Well, here's how. So how's the Feel Good method set up online? Well, we decrease your back pain by practicing exercises in the modules that are set out each week. Each week, I'm going to show you a list. So the first week is mobility and pain management. The modules are going to include videos of stretches and massaging videos where you're going to learn how to trigger point the tightness so that you have less nagging back pain. Also, I'm going to talk about modalities so you learn how to use a hot pack or a cold pack and manage your discomfort at home. Weeks 2 to 4 is strengthening and creating stability for your back. So week 2, you start with your body weight exercises. These are simple videos that you can do at home and won't need equipment. Week 3, however, is the resistance band videos. This is something I'm going to ask you to purchase online, which is really simple to do, but the resistance band is going to help you increase that strength even more. Week 4 is using a therapy ball, or also called a Swiss ball. This is going to be important because we're going to create coordination and control of the hips and the core so you have less back pain. So yes, again, I'm going to ask you to purchase a therapy ball, but it's also a simple thing that you can find online. Week 5 is the routine and learning how to do proper daily function. So what this means is that I'm going to have a 15-minute exercise video for each of the 4 out of the 7 days of the week. So this is a routine that includes the stretching, all of the strengthening exercises. So that means 4 out of the 7 days of the week, you're going to keep your back getting better, getting stronger, so you don't have that pain coming back. And then by learning about postural control during activities, whether it's bending and lifting and standing, it's going to be very important for you to do these things so that you consistently make your back feel better. And I'm going to show you how to improve your body positioning, whether you're sleeping or sitting, and also help your awareness of how you're positioning yourself so that the back pain can be at bay. So it's a 4-week process where you learn the exercises, and by week 5, you already know a routine that you can do 4 out of the 7 days of the week. Week 1 is about improving your motion. So we have stretching modules for people who have pain with standing or sitting. So if you have pain with standing, you're going to focus on these exercises that should be the opposite of extension, which is flexion. We're going to engage the core so that you don't hyperextend and cause the spine to close. Also, we're going to bring the knee to chest so that we can stop the hip from pushing back and causing that nagging back pain. This is going to help decrease the restrictions of those tight hip muscles, tight lower back muscles that's making it painful to stand. Also, we're going to focus on exercises that does the opposite of sitting or bending. So if you're having a lot of pain with sitting or bending when you're lifting, you want to do exercises that do the opposite of flexion. This means that you're going to do exercise that focuses on extension, upright posture. So if you slouch a lot when you sit, we want to extend the back because it's going to provide less pressure on the disc. Also, we want to make sure that our hips knows how to engage properly so that when we bend and lift, we can extend fully. So decreasing the restrictions of tight hip and lower back muscles are important so that you have less pain with sitting and bending. After improving your motion in phase 1, you're going to move on to the phase 2, which is the strengthening modules. What we're doing here is week 2, focusing on the body weight exercises, so without equipment. We're going to learn how to strengthen your lower body, your upper body. We're going to engage your core, doing some simple exercises, nothing complex, and this is going to help your function with the bending and lifting, with the standing. So all these exercises are easy to do without equipment. Then we're going to add a little bit more resistance. We're going to use week 3 to learn the resistance band exercises. So we're going to use the elastic bands such as a loop band for your lower body. We're going to use the resistance band for your upper body so you can add a little bit more tension and increase your strength. Also, week 4 is going to focus on strengthening your body with the therapy ball, also known as the Swiss ball. This is going to be good because we're going to help you learn how to engage your core and your hip at the same time. So these strengthening modules are going to be good to help you keep that body in the right place after improving your motion. Lastly, we're going to learn a little bit more about function. So we're going to learn how to do bending and lifting techniques, so good proper positioning, learning step-by-step mechanics, and how to engage your hip and your core at the same time. We're going to learn techniques of standing, walking, so proper foot positioning so we don't have that back pain. And then also hip positioning to decrease the strain that's causing in the lower back. We're going to learn how to properly weight shift so we're not putting our attention all the time on one side. And we're going to engage the core so that it doesn't feel like our back is being strained when we're moving. We're going to learn about sleeping positioning, whether it's proper positioning when we're laying face up, laying on our sides, laying face down. What should you expect with the exercises with Feel Good? Well, we're going to find out now. The best way to decrease back pain is by doing something every day. So learning a routine is very important. If you allow the pain to continue, then you're going to have an issue where you're going to be taking too much medicine and it's not going to be addressing the root cause of the pain. And if you don't have the proper motion or strength, you're going to keep straining your back every time you do a certain activity or something repetitively. The method of the Feel Good is to help you with curated exercises designed by a doctor of physical therapy, which is me. And I'm only asking you to do exercises 4 out of the 7 days of the week. And it's always going to be 15 minutes or less. So why not learn a routine that can help you stop this back pain instead of not doing the right thing? With the Feel Good method, you're going to need a little bit of equipment. You're going to need a chair that's comfortable to sit on to do the seated exercises. You're going to need loop bands and resistance bands to strengthen your body just a little bit more than just doing your body weight. And you're going to need a therapy ball. I recommend 64 to 72 inch therapy ball, which is going to be easier to sit and do the exercises that strengthen your core and hip at the same time. If you purchase the Feel Good method, I'm going to offer you an easier way to decrease your back pain at home, and you're going to see a reduction of costs in your health. We're going to lower the cost for your medical bills by doing something so easy, which is signing up for the Feel Good method. On average, 75 to 85% of people have back pain, and 1 in 3 individuals have recurring back pain. So that means per year, your yearly health insurance deductible, which on average could be like $1,000 to $700, it's something that you're paying every time you go to the doctors, with the average copay being $25 to $28 per visit. And if you do the Feel Good method, you're going to see an economic benefit in the healthcare system just because you're doing PT online with me. So if you do the Feel Good method, you're going to stop all this healthcare headaches and you're going to feel better without having to cost you a lot of money. So thank you for watching my presentation on the Feel Good method. I hope you sign up with me and learn a routine that's going to help you not for today, but for tomorrow, and that you can always know that I have a method that's going to help you decrease your back pain. So follow the Feel Good method and follow me, Phil Cunha, a doctor of physical therapy who has exercises curated for you.